How to recognize symptoms of throat cancer. Everyone is at risk for throat cancer, a general term that describes cancer of either the pharynx or larynx. 1. Although throat cancer is relatively uncommon, you should be aware of and recognize any potential signs of the disease. 2. If you discover that you have any symptoms, see your doctor as soon as possible. She can confirm a diagnosis of throat cancer and develop a treatment plan. Identifying throat cancer. Recognize your risk for throat cancer. Doctors know that throat cancer is caused by a genetic mutation in the cells of the throat, though they are not sure what spurs this mutation. Men are more likely to contract throat cancer than women. 5. Your risk for developing throat cancer increases with age. 6. People who smoke and use chewing tobacco are at a higher risk of developing throat cancer. 7. Excessive alcohol consumption increases your risk. 8. In fact, alcohol and tobacco consumption are the primary risk factors for developing throat cancer. 9. Having HPV, human papilloma virus, can make you more prone to throat cancer. 10. Not eating sufficient fruits and vegetables can raise your risk for contracting throat cancer. 11. Having gastroesophageal reflux disease, or GERD, may also increase your risk. 12. Determine possible symptoms. Most symptoms of throat cancer aren't specific to cancer, so you'll need to be extra vigilant about watching your oral cavity. Coughing. Changes in the voice, which may include hoarseness or inability to speak clearly. Problems swallowing. Ear pain. Sores or lumps that don't heal on their own or with over-the-counter treatments. A sore throat. Weight loss. 15. Frequent headaches. 16. Examine your throat for lumps and irregularities. Irregular growths and lumps can be a sign of throat cancer. Examining your throat may help you recognize unusual growths. Stick out your tongue and see if you can identify any lesions or growths on it. 18. It may be slightly more difficult to examine the inside of your mouth or your throat, but open your mouth as wide as you can and look inside. Shining a light inside your mouth may also help you recognize any irregularities. Check your mouth and throat regularly so that you know how the area looks usually. 19. Look for changes in the appearance of your throat, including differences in color or skin texture. Growths that appear wart or ulcer-like may indicate throat cancer. 20. Schedule an appointment with your doctor if you notice any of these symptoms. 21. Having regular dental checkups can also help with monitoring for any mouth or throat changes or concerns. Watch for pain or bleeding. Pay attention to your mouth and throat for any extended pain or bleeding in your mouth or throat. These symptoms might indicate a more serious condition such as throat cancer, in particular if they don't heal. Observe lingering pain in throat, especially when you swallow. Look for any bleeding from lesions, growths, or lumps. Talk to your partner or spouse. Ask your partner or spouse to look in your throat or ask if they've noticed symptoms of throat cancer. He or she may recognize symptoms or differences in your oral cavity more quickly than you do.